Hi, my name is Zachary Bond. Our group did our presentation on intellectual disabilities. Cognitive impairment, i.e., low incidence, can be defined as when a person has trouble remembering, learning new things, concentrating, or making decisions that affect their everyday life. These can range from mild to severe. These students are diagnosed before the age of 18. High incidence disabilities are disabilities that occur somewhat frequently in the K through 12 population, such as learning disabilities, ADHD, and mild intellectual disabilities. An antonym to high incident disabilities is low incident disabilities. There are signs teachers can recognize that can help know if one of our students has a cognitive impairment, such as confusion, poor motor coordination, loss or short-term and long-term memory, identity confusion, and impaired judgment. Mild cognitive impairments, such as memory problems, can also affect students. It's normal to forget things growing up, and people with MCI or mild cognitive impairment students can do their normal activities and take care of themselves. Students that have a mild cognitive impairment lose things often, forget events and appointments, have issues coming up with words on their own. Students that suffer from MCI can also be affected by medications that they are taking. Students that have MCI have a chance of it leading to early Alzheimer's disease. If a student has MCI, it is important for them to go to their healthcare provider every 6 to 12 months. Cognitive impairment and its different levels of severity can be difficult in a classroom setting. Cognitive impairment affects the brain and the memory. This can be difficult in the classroom because the students are there to learn, and if your students can't remember things or learn, it can be difficult for them to succeed. Students can also be teased or bullied. This not only affects students' learning, but it can also affect them socially. Some examples of students that can be affected like this are students with Down syndrome, traumatic injury, ADD, dyslexia or dyscalculia, difficulty learning math, and learning disabilities in general. How can we as teachers help students that suffer from an intellectual disability? We have a responsibility for the learning outcomes of a special education student, and we equally share this with the special education teacher. As a classroom teacher, we need to be aware of the student's IEP goals. The classroom teacher plays a significant role in determining the goals and providing instruction to help the student reach the IEP goals. Collaboration is for a student on an IEP is very hard. Time is allocated for teachers to collaborate with other teachers and parents regarding the student. Expectations are not set according to a student's classification. It is recognized that a classification does not determine how much or how well the student will learn or perform. As teachers, we need to understand that good instruction incorporates variation in delivery, activities, expectations, and assessment. This way we can accommodate diverse learning strengths and needs. Being a teacher, we have to hold our students accountable. Having accountability for our students is considered a challenge and not a threat. As required by IDEA 97, students with disabilities are included in state and district assessments. Parents are considered an integral part of the team in helping their student that is on an IEP. Parents can help teachers by going to the child's doctor and seeking help from other local resources. It is important for parents to catch any intellectual disabilities that their child may have at the earliest signs so that the student can succeed in school.